Bethesda Hospital in Mkhuze in the Umkhanyakude district of northern KwaZulu-Natal serves about 100,000 people. Decimated by HIV in the 90s, these days health challenges also include TB, malaria and malnutrition. It's an area Dr. Thulani Ngwenya is familiar with. He grew up about 80 kilometers away.
I was born from the area of Ingwavuma, in the small area of Madeya, under the traditional leadership of Matenjwa.
Today, he's treating a patient from the area who has a chest infection.
I always wanted to be a doctor. I got sick, I had a chicken pox. I was not a sicky child, by the way, but I had that chicken pox at that particular time. Then I was taken to the hospital by my uncle. There was that white doctor that was sitting in front of me, asking questions. So my uncle had to translate for me. I was frustrated. So the Gogos, when they come here, they also experience the same. Then I said, okay, after my school, I want to be a doctor so that I'll be speaking the very same language that my people are speaking.
His dream of becoming a doctor and serving his community was a long time coming. But when he finished high school, there was no money for further education.
I used to do some part-time jobs. I remember receiving the phone call from one of the primary schools. Then I started teaching with my matric. The department is not able to pay me. The community were paying me, were putting together money to pay me at the end of the month. I just wanted some money to go to university, to register. Then I was going to see what happened.
The health department eventually agreed to fund his studies, and in 2008 he enrolled at medical school at the University of KwaZulu-Natal. In his first year, he contacted the Umthombo Youth Development Foundation for more help. Umthombo helps to produce rural health workers. As with other professions, most doctors and nurses prefer to work in cities. Umthombo is changing that. It helps students from rural schools to become health workers. The newly qualified workers then return to work at public hospitals in the area where they grew up.
Knowing my background, that if I fail or whatever, I don't get support, Umthombo was there, then I approached Umthombo for mentorship, because the mentorship of Umthombo was very useful, I could see.
Despite his intentions, once he had qualified as a doctor, practicing in the community he grew up in seemed too close to home.
I just need to be away from them a little bit until maybe they forget about me, that I was a child running naked in front of them. Now I have to make them naked in front of me.
Although Bethesda Hospital serves a different community, Ngwenya believes that for them, having someone who speaks the language and knows the area makes a difference.
I think it's better because it encourages them and it makes them open, like free to share with me. I understand where they're coming from. So I think that makes things easier to get their problem. That makes positive for me. That's what I always wanted, actually.
Ngwenya has no plans to forsake this remote hospital for the bright city lights. He says he's here to serve as long as he's needed.